Good afternoon. Thank you for joining us. Please stay tuned for an important announcement from the Springfield-Greene County Health Department Director, Clay Goddard.
Hello everyone, and thank you for joining us. In the past 24 hours, we have had 20 new confirmed cases of COVID-19 diagnosed in Greene County residents. That is a number that we don't like to see. We don't want to see that number, but I think that there is a silver lining here. We do believe that this influx of cases represents a second wave of illness in our community, and I won't downplay that. But these cases have been identified early, and they've been contained in their course of illness very early as well. On Wednesday, we had our busiest single day at the mobile testing site with 138 tests given. Our community has come together to dramatically expand testing capacity, and when you test more, you're naturally going to find more cases. We would have had these 20 cases regardless, but we likely would have had them spread out over a few weeks. Those people might have been out in the community spreading disease otherwise and not knowing. But this is an example of an aggressive testing strategy working quickly and allowing us to contain illness quickly. Of these 20 new cases, none represent clients from the Great Clips exposure. To date, we have received 42 negative test results from that group, and I'm encouraged by this news. I think it's solid evidence of the value and protective nature of masking. And I've got my own here, my Kansas City Chiefs mask that I like to use when I go into community settings. There are two groups that are making up the majority of these cases. First, Wilson's Creek Nursing and Rehab had a symptomatic patient that they tested, and when a positive test result came back, they moved to test every single patient and staff member in that facility. 6 of our new cases are from that facility, 2 staff members and 4 patients. But interestingly, the 2 staff are asymptomatic, 1 patient is asymptomatic, 1 patient is experiencing mild symptoms, and the 2 remaining patients have complex medical histories that we continue to investigate to determine if they're experiencing symptoms. We believe the quick action of the team at Wilson's Creek caught this illness early. Wilson's Creek has not allowed visitors, so we do believe that staff most likely brought the illness into the facility. But we're continuing our investigation to determine if this is an example of asymptomatic spread. Another 6 of our cases were from a traveling construction crew. Similarly, 1 individual knew they had been exposed to other cases out of state, and so the whole crew sought testing. Some tests of these crew members are still pending, but this is an example of our new protocol to test all contacts of cases and highlights the value of early identification of cases. Another 6 of the cases are a mix of close contacts of other cases or travel-related cases. And finally, 2 of the cases seem to be at this time evidence of community spread. Remember, that means we are not, at least right now, confident in where these individuals picked up COVID-19. These and the nursing home cases are those of greatest concern for me. Yesterday, we released a number of potential public exposure notifications, and unfortunately, I have another 5 to release today. On Thursday, May 21st, one of our cases visited the Walmart Supercenter at 3520 West Sunshine sometime in the afternoon, although we do not have a specific time. The individual was symptomatic and not masked at that time. On Thursday, May 21st, one of our cases went to Pet's Way at 1717 West Kearney around 6 p.m. They were infectious but not symptomatic and were not masked. Also on Thursday, May 21st, one of our cases visited Price Cutter at 1831 West Kearney around 5 p.m. They were infectious but not symptomatic and were not masked. On Friday, May 22nd, another case went to the Walmart Neighborhood Market at 3536 West Mount Vernon around 4 p.m. They were infectious but not symptomatic and were not masked. And on Sunday, May 24th, another case visited the Walmart Supercenter at 3515 South Campbell around 3 p.m. They were infectious but not symptomatic and also were not masked. Remember, these community spread exposures are low risk, but we do feel the need to inform our community. People that might have been in those facilities at that time are not asked to quarantine themselves, not asked to isolate, but we do ask that you monitor for symptoms. That's what we should all be doing as we continue to navigate this pandemic. I'm happy to take any questions at this time. I think I'll turn it over to Cora to field those.
Happy to do that. Clay, I think your Kansas City Chiefs mask is very nice, but I want to point out that mine is reversible, so I have two stylish options. So I do wear that when I go out in public. Okay, let's open the questions up to people in the room. Eric?
I've got family of a patient at Morningside East telling me that they have a new case that hadn't been disclosed before. Are they understanding properly?
So I covered this, I believe, in a briefing maybe a week and a half ago, that we had one of the original cases from the original outbreak in that facility who tested positive again. There's some, fuzziness around this because we found from a study in South Korea that oftentimes recovered patients are still shedding dead RNA and can test positive. We believe that that's the case here, but out of all due caution, they retested the entire facility, including all workers and residents. We had no positives, and we're running a second round of tests just to make sure today in our laboratory, and would expect those results early this afternoon. So once again, I think this is an evolution in this process. If you'll recall, early on in Morningside East, we were not able to test everybody in the facility. We're now able to do that. We've done that with Morningside East, and we've done that with Wilson's Creek, and I think that's a real positive development.
Then are some of those tests then going to be the antibody test to determine if maybe they were asymptomatic at one point?
So we're not doing antibody testing at this time. There's still too many problems with that testing, and until I have great confidence in that testing, I won't be doing any of that. Now, that doesn't prohibit a provider from doing that, or the administration at Morningside East from engaging in that if they choose, but we're not recommending that at this time.
Nathan, I'll open up to you. Do you have any questions? Are they going to be coming from Katie? Okay. He's shaking his head no. Joe Hickman from KY3.
Okay. First question, we'll just go to the Great Clips thing and get that out of the way. How many tests do you still have to go? And do you want to comment on, you're talking about the fuzziness aspect. At the very least, I think there was, I'm sure you saw the story, some fuzziness as far as them understanding how things were supposed to go with them. I'm sure you've seen the story. I'll just let you make whatever comments you want to make on that.
We've had 42 tests. I'm not sure if we have any in the queue in the testing apparatus today. All 42 of those tests have come back negative. Once again, I view this as a fabulous development. This is really actual science that we have that would demonstrate that if you're in close proximity for an extended period of time with somebody who is symptomatic, maybe masking is going to be a mitigating factor. So that's really valuable science, and I've received emails from all over the country on this, looking for a deeper dive from a research perspective. I want to assure anyone that's watching, that's asked me about that we will be doing further research on the types of masks worn, what the duration was of their haircut, all of those questions that would work into a peer-reviewed journal article that is on our to-do list. Let's revisit the facts of the case, and I think that I'll just start there. Number one, when we look at a mass exposure, a public exposure, we have to evaluate what the risk to the general public is. And so if you'll recall, we had an exposure earlier this year where there were 65 individuals exposed. We chose not to release the name of the facility. We did that because we knew that we had a closed universe where we were able to contact everybody without question. When we run into situations where we're unsure of that, we as public health professionals have a duty to warn. And so we have chosen a path in Springfield, Missouri of being very transparent about disease exposures. And that was really at the heart of going public with this event. So it was not intended to be critical of anyone, but we have to notify the public in those scenarios. In fact, I would venture a guess that if we had not gone public with that, and it had leaked out on social media, which it would have, you would be here today asking me why we did not go public with the event. So that is, in short, my response to that question, but I'd be happy to handle any follow-ups that you might have.
As you've reviewed the woman who came and was kind of confused as to what she needed to do and not do and whether she needed to be tested or not tested, are you satisfied with the way the health department handled that situation as far as her being tested and waiting to get the results and things of that sort?
So you're starting to blur a little bit into private health information, so I'm going to be very careful about how I work around this question because we don't want to violate an individual's privacy for sure. We've been very clear since before we even had our first positive case in Springfield, Missouri and Greene County, that if you're sick, you stay home. And really, that's going to be one of the fundamental prevention practices that we have to engage in. We also feel very strongly that you should get tested, and if you can access that testing, it's very important. Everyone that goes through our mobile test unit signs a patient responsibility form where they agree to go home and self-isolate until we have those results back. So those are two very important components to remember as we're navigating this in the future. And I'm going to say it again. I've said it many times. And if you think about the public notifications we gave today, I think those should really highlight this. If you're sick, stay home. If you have one of the hallmark symptoms of COVID-19, find a way to access a physician. If you don't have a physician, call 874-1211. We will help you navigate those waters. We want everybody to get tested if they can.
When I saw the Lake of the Ozarks situation, the photos this weekend, the first thing I thought of was you because I've learned density and intensity. And the first thing I thought of was that's density and that's intensity. That's the petri dish you talk about all the time. The health departments from St. Louis and Kansas City have had their reactions to that situation up there as overseeing the third largest health department. What's your reaction to that? And that is a prime example of what you talk about as far as being that worst scenario, right?
So I keenly understand the frustrations that we've all experienced being cooped up and a desire to blow off steam. But in my opinion, and I think it's a fairly educated opinion on disease control, the behavior that was exhibited in that particular setting that I saw is irresponsible. We know that a great portion of our cases have been imported. We've done a tremendous job as a community of keeping our case counts and our disease morbidity rates low. And that has not come without significant sacrifice, both personally and economically. And to take those kinds of risk to continue to bring disease back or potentially bring disease back to our community is selfish in my opinion. That's just coming from my chair. Obviously, there are going to be people that disagree with me, but we're going to be in this fight for a while. Let's just try to stay the course if at all possible.
Since that time, there's been a lot of talk about the enforcement of it too. The officials up there said that they didn't think it was a local thing. The governor said it's not the state's responsibility. As someone who heads a health department and watching all that, do you have an opinion as to who should be enforcing something of that nature? Because I know there's a lot of conflicting views on that.
I don't think I'm going to wade into that, Joe, but I will tell you this. I think we believe that we have to lead from Springfield, Missouri, and so we're not going to dodge responsibility, and if it's something that we can enforce, I've got my city manager over here. I hope that he's going to nod his head that we are going to enforce it if it's something that we can. So, you know, we do have a very interesting model of governance in Missouri. There's a lot of local control, and with that comes a responsibility. And I think we intend to, you know, try to be good stewards of that responsibility.
Have you had to deal with anything like that, or restaurant situations or anything so far that have come up?
We've had complaints.
Yeah, we've had some complaints. I think typically the approach is, you know, you don't rush in there with a SWAT team, and you go and you approach the managers and you talk through these issues. So I think that they've gone fairly smoothly, maybe with a few exceptions. But I'm not really involved in that enforcement side of the equation.
From the situation up there to wearing of masks, people being taunted for wearing masks and for not wearing masks, from the situation with Great Clips having to close down because of the threats, obviously, as you have just pointed out, this is a politicized situation where people have views on both sides, and those views are very strong. Not necessarily anything's wrong, not necessarily anything's right, but you guys have to play and toe that line and try to figure out how you're going to do this, all with the ultimate goal is to keep people healthy. But what is it like to have to deal with that, where you have people with very strong views on both sides about something as simple as wearing a mask or not wearing a mask? And as you said, you understand people wanting to get out and do things, but you're concerned about their health. How difficult is that during what I would call a politically charged time?
It's not easy, Joe, for sure. In my experience, whenever you politicize a public health issue, there's a lot of danger there. But I've also long contended that as we navigate this, I mean, you know, the mayor has pointed out through his research going back to 1918, as they navigated this, it was fraught with peril. I know that if you look at St. Louis with Dr. Starkloff and their business community, that was not an easy journey either. A lot of times things get glossed over as, you know, they fade from our mind. We are very conscious that if we thread the needle right on this, we're going to have both sides, you know, get sore at us from time to time, and that's okay. That's part of a community dialogue. It's how you get through tough times, and you work together as a community. I'm going to say this. I am very proud of Springfield and Greene County. This is not an easy issue, but for the most part, discourse has been very civil. You know, we've taken feedback, and I think that we've utilized that collaborative spirit very well so far, and I'm hopeful that we can continue to do that.
And lastly, Steve Cox over at Cox did mention, Steve Edwards over at Cox did mention that he felt that from him being out and seeing things, he felt that there'd been some backsliding, for lack of a better term. Are you concerned that as the summer goes on and you have more things like gatherings of people and people getting out more and not being as worried maybe about things, are you worried about that backsliding situation?
I think it's human nature, and I don't remember if I mentioned it in this forum or not, but the New York Times did an op-ed, and through the history of pandemics, there's usually two ends to pandemics. There's a medical end where the disease stops spreading, and there's a societal end where people just move on mentally from it. We really can't afford to do that, and I would hope that a 20-case day is a wake-up call, that this hasn't gone anywhere. I think we have something like 50 active cases. And by the way, yesterday's 20 reports, that's the most we've had since we've had our first one in early March. So this is going to be here for a while, folks. we're going to have to figure out a way to coexist with it. And there's really a lot of ways you can do that if you'll be responsible and mitigate it. It's going to require a lot of personal responsibility. And your health department, your health systems, your city council, your county commission can't go away through the stroke of a pen. It's going to require all of us working together.
And one thing, I'm sorry, since you brought something up, that 20-case spike, though, is mainly due probably to testing?
So I'll give you a great example. We've got that machine now in our laboratory. We've had a case on this crew. We tested everybody on the crew. We got 6 cases. I think they were all asymptomatic when we tested them. That's early identification. That's exactly what we wanted the protocol to be. And if we get really aggressive about our testing and we identify cases early, we're able to stop the chain of infection. So, by the way, all of those cases now, we'll find out who their contacts are. We're going to rinse, wash, repeat until we run out of cases that test positive. So, yes, there are some silver linings to this cloud.
How are the preparations for the large testing event the state's doing coming along? And what sort of information will that be able to give you?
So you're going to have a lot more testing in the community, and of course that'll bring in people from all over Southwest Missouri. So that gives you just another window into the disease. It's basically an all-comers call, so I don't really know what to expect with regards to the results. Our involvement has been just ancillary. We help them identify a site. I think we're helping do some fit testing for N95 mask, but that's going to be mostly a lift by the State Health Department and the National Guard.
Okay. We have several questions. For various reasons, there are reporters who are not able to be in the room with us. So in the interest of transparency, we do repeat all of the questions that are sent in to us. So there may be some redundancy, and there may be some we can't answer, but we are committed to asking all of the questions that are sent to us. So from Greg Holman with the News Leader. What is the Health Department's response to the comments by Bill Robb, attorney for the Great Clips stylist, on KYTV? The Health Department, in my mind, kind of cast, this is his quote from this attorney, the Health Department, in my mind, kind of cast the Great Clips in the stylist in a bad light and almost was critical in the way they behaved, unquote. The Health Department, in my mind, kind of, okay, he just repeated that. We don't typically respond to attorneys through the news media, but I will turn to Clay and say ask if there's anything you want to add about the facts of this situation. Okay, thank you. Second question from Greg Holman. Various broadcast outlets are reporting so far that the hairstylist called the doctor after symptoms including loss of smell and taste, asked the Mercy/Go Health urgent care for testing, was not tested, but was told she had allergies and was sent home with allergy medication. Due to that situation, has the health department addressed the situation in any general way with Mercy? For example, is there a discussion of COVID-19 symptoms or which symptoms ought to trigger a test? Would it not be a big red flag if a patient presented with loss of smell or taste?
So we're, once again, edging into areas that involve private health information, so I would not be willing to comment on that situation.
Third and final question from Greg Holman. Has the stylist directly or through her attorney, or has Great Clips requested an apology or some other action from the health department?
Not to my knowledge, no. Once again, I want to revisit, the scenario where we've been talking all along. If you're sick, please don't work. Please don't go out in public. The other thing that I'll point out is that it's my understanding that people got beat up pretty badly on social media platforms. That's unfortunate. When we make these notifications, solely based on people being allowed to understand what their risk is. That's not an invitation to go out and be voyeuristic, search for people that you think it might be, and then attack them. I would encourage us to engage in civil discourse on social media. I don't understand the utility or the value in tearing people down. I don't have many accounts in that realm, but it's my understanding that that's what it's kind of devolved into, and I find that to be very unfortunate. It's not really constructive for a community that's trying to navigate a crisis of this magnitude.
From Katie Cole, also at the News Leader, where do these new cases put us as far as resources to investigate, test, and handle it from a hospital standpoint? Do you still feel comfortable that we have enough resources at this point?
That's an excellent question, Katie. On the testing side, of course, we've been in the yellow, but that's simply a reflection of the fact that we're running so many people through that test site. I actually view that as a positive, oddly enough. We could, probably stand up another one if we had to, if we ran into that situation. Right now, my biggest concerns are the public health capacity piece. It takes an enormous lift to thoroughly investigate these from an epidemiologic perspective. So remember, this is not a button or a computer algorithm that you can use. These are actually requiring conversations. They require follow-up phone calls. They are very, very difficult to complete and very labor-intensive. So that is my concern, is if we have more of these days like this. I think that's a good old R&B song. But if we have many more days like this, we end up in a situation where it's hard for us to handle quickly. And really our goal, I think, is typically to have these investigated within a 24-hour period so we can make the associated actions, isolation, quarantine, arrange for contact testing, those sorts of things. That's a long-winded way of saying that this big count days like that stress us as a system, but we're very resilient. We've got a great staff. They're tired, but they're still itching for a fight, and I can't compliment them enough.
From Christine Temple at the Springfield Business Journal, if masking was a key in preventing spread in the Great Clips case, why wouldn't the city or the health department require masks in all public places? What factors prevent that decision?
So this science continues to evolve, and actually I think it's an excellent question because my thinking's evolved on this. And in fact, I think I'm on the record very early on in one of the first recordings we did on COVID-19 expressing the belief that in Asia it's really a cultural phenomenon rather than a mitigating factor. So as we continue to navigate this, I think that we're going to focus really on continuing to make this a best practice and a guidance. Right now, unfortunately, for whatever reason, this issue has been politicized, and I just don't know what the mood is in the community. I know it's gone bad in several communities where they've legislated that approach. It would be my hope that people look at the science. We had 42 cases that are directly exposed for an extended period of time to symptomatic cases, and they didn't get sick. That should tell you the story that you need to know. From my seat, I'm going to continue to mask when I go into the grocery store, when I go into public settings, because I've got a loved one at home. I've got a mother that falls into one of the risk categories. I'm going to do everything I can to protect myself and by proxy protecting them as well.
This is the final question that I have from Jason Ward at Ozarks Independent. Because of HIPAA regulations, even if a patient makes complete false claims about the department or a healthcare provider, is it true that you can't comment because of that HIPAA?
That's a loaded question with a lot of hypotheticals, Jason, that I don't totally comprehend. Let me just say this. I don't think that it's productive to get into that kind of mudslinging. Our intent was simply to notify the public of potential for exposure to disease. That's a best practice. It might potentially stop the chain of infection. By the way, there was a case spread in that facility from stylist to stylist, so I think that our actions were justified, and it's something that I would do again if the same circumstances were present.
Unless there's any other questions, we'll close out for now. I do want to point out that the Wilsons Creek facility has issued a statement. We won't read that statement. It's a little bit lengthy, but we will provide it on our website, and that is at health.springfieldmo.gov/coronavirus. If you have questions, you can also call our hotline at 874-1211. Thank you, and have a safe day.
I do have one thing I was going to ask just for clarification. There might be some people watching who are wondering why y'all being close together aren't wearing a mask. I'm sure there's got to be one or two people out there probably wondering.
Yeah. Have you ever tried to communicate with somebody that's wearing a mask? It's just really not effective. So, you know, we are less than 6 feet apart, but we think it's necessary to effectively convey our messaging. We had a staff meeting where we were all masked the other day, and it's a hard thing to communicate that way. So that's why what the thought process is.